Why do you think, in spite of all this data, research, we have decades of evidence showing the harm of tobacco, why are we seeing numbers rise in terms of use and prevalence?
In Nigeria, for example, what the data shows is that there is no decline, there is no increase. There are a small number of people that benefit from a high increase in tobacco consumption. But they have this money, they have influence, and they can actually aggregate themselves and pursue their own interest.
There's a new generation they're targeting now, and most importantly, we are in the technology age where traditional marketing is no longer what it was before. Do you think these tobacco control stakeholders are ready to tackle this new generation and this new marketing ecosystem that the tobacco industry are already deploying? Welcome to Tobacco Control Conversations, a CC podcast series where we translate tobacco control research into real-world conversations. To commemorate the World No Tobacco Day, I'm joined by Dr. Adedeji Adeniran, the Director of Research at the Center for the Study of the Economies of Africa. It's good to have you here.
Thank you so much. Happy to be here, and hope we have a nice conversation.
Yes, definitely. We are talking about data in tobacco control research. And most importantly, especially because of your work in tobacco control, leading it at the center, you recently, or I think in 2023, you led the the role of states in tobacco research for Nigeria. And currently, you're also still leading tobacco control data initiative in several African countries. So from your perspective, just on the regional level, and I will also say the global level, why do you think, in spite of all this data, research, we have decades of evidence showing the harm of tobacco control, showing its impact on health, on economic systems of nations? Why is it still persisting? Why are we seeing numbers rise in terms of use and prevalence?
Okay. So really looking at the data on tobacco control in Africa, in Nigeria, and globally, I think I want us to not start on a very pessimistic note to say, okay, it has been rising. Really, for example, the upcoming GATS report in Nigeria really shows that there is actually no increase. So in terms of the share of people smoking, that shows you that sometimes some of the advocacy research and what has been done has been really effective, such that we don't have a spike or increase in the tobacco consumption and cigarette use. But also globally too, it's part of the success story actually in public health that there's this consciousness and really advocacy data and everything that is showing that we are making decent impact on tobacco control. However, that still doesn't mean that we have achieved our results. In Nigeria, for example, what the data shows is that there is no decline, there is no increase. But when you look at the share of population, population in terms of numbers has increased. It just tells you that the total number has increased. Just the share of the population has not increased. So in a way, it still means that there is actually our work is well cut out. Now, why are we not seeing the change? If we really want to really get to the result, we want as a center to really get to a situation whereby we say we don't need to really do this research because what we are doing is already achieved this result. Sometimes in the past we've talked about PIB development, sovereign wealth. CC has worked in this area, but we don't really do much work because some of what we have advocated for us and really research about has actually made it into policy, and it has been made. So it's not about really doing research for research's sake, but ensuring that we get to the result. That's our goal. That's our purpose. In tobacco research, evidently there's actually not been. We have not reached where we ought to be, and I think it's part of the fact that when you look at data and policy, I think it's better not to really look at them as very separate things and to look at them as a process. So there's the aspect of data generation. You turn this data into insight, which we call research, and you turn this research into a tools that policymakers can use, that advocates can use, and can really lead to real change. But that process of real change, it's not linear. In many instances, you could see that you're dealing with not just evidence, not just really what is really obvious, but you're also dealing with politics. And I think when you get to the realm of politics, it's more complicated. It's not about fact, it's about interest. And when you look at that interest dimension, especially in the tobacco control space, there are two players. On the one hand, the general public, everyone. Because, for example, it's not just about smokers alone. If they are smokers, they are actually secondhand smoking. There's even thought, whereby, secondhand is you are within the vicinity of it. But me and you, we walk through the streets, maybe someone actually littering of tobacco, cigarette, and all of those things can actually pollute maybe agricultural product in some ways. So all of that are there. The general public perspective. So when we talked about, we need to do tobacco control, the beneficiaries are public. But the costs of that is imposed on the tobacco industry that tends to lose their big cash cow for them. Now, as an economist, you can really see this as a political economic argument, which is very the idea that the people that are going to benefit in terms of tobacco industry, they are concentrated, even though they are small. There are a small number of people that benefit from a high increase in tobacco consumption. But they have this money, they have influence, and they can actually aggregate themselves and pursue their own interest, either influencing policy, either doing strategic marketing process in order to dampen whatever policy government is trying to make. On the other hand, the beneficiaries, which is the public, that would benefit from better health system, and our health system burden from tobacco smoking or smokers that will become a burden either through subsidy to government or even because when doctors is treating someone, actually it's also a trade-off to another one. Those public, one of the tragedies that we are also not as banded as the tobacco industry, because me and you, we think about the benefits to us, yes, but we don't think as if this benefit, it's really, our interest is not so aggregated like the tobacco industry. So whereas their own voice is louder than the general public voices. Also, when you look at the smokers themselves, they tend to, a lot of smokers really have that facts that's because it's written clearly. Smokers are liable to die young. There's this causation. But most times they would see and say, okay, I've been smoking for the last 10 years, 5 years. Because it takes actually a long time for it to actually lead to some of these diseases. They think it's not. So most times they also don't factor in that time. That sometimes by the time maybe the disease or some of the impact will come in, it might be in your 50s that you are actually maybe already out of the labor market, or a lot of life challenges such that it's more difficult for them. But because they are somehow young, not really calculating the cost over time in a way too. So by the time you look at it, you find out that the key issue is actually politics of it, not really the economics. I think the economic argument, the health argument is clear that tobacco is harmful. And the economic argument that in terms of the benefit and cost, the benefit, wherever you think about it, that any country gain from tobacco smoking, whether in terms of government revenue from the tax industry or investment by the tobacco industry, when you compare it to the cost on the economy, it's really, really huge. We've done the number for Nigeria. It shows like about more than 10-fold differences between what we claim as the benefit and what we are seeing at the cost. So in a way, there's no comparison in terms of the negative health impact or the public health challenges. But the question is, how do we move those kind of very quality evidence into a way that we can make policy that's really change a lot of things? That's a politics. And politics, it's really emotional, it's interest driven, and all of those comes into play. So, but I would still argue that as an institution working on really evidence-based policy making, data is still important because data help policymakers in making better policy. It helps advocates and empowers them, but also it also constrains the tobacco industry from polluting the environment with dubious facts. It helps the public also in terms of awareness, such that they know the state of things, and they could actually be, because sometimes too, even if the political system is weak, a clear political will can also change public support for better policy making. So in all of this, I think the role for data is still clear, but we also need to really say that data, just like data research, you don't expect the effects to be immediate. Yes. It also takes time because you need to influence policymakers. Policymakers needs to really look at and engage the public interest for it and priority around it. All of that are part of what you don't influence as a researcher. But if there is actually, in the first instance, no evidence, if there is no data, I think it empowers the tobacco industry even more, because they will make the case clearly that there is no evidence for policy government is making. But when there is evidence, then there's a different ballgame. It's a different kind of points they are putting on the table. Yeah, so I think the politics of policy making is actually where the big issue lies, and not actually in terms of the fact around the economics of it or the public dimension.
Yes, and what you said brings me to the other point of, you mentioned the government, you mentioned politics. I think that answers the question to why even the fact that, as you mentioned, the harm impact is known, but nothing is being, I won't say nothing is being done, but we're not able to see the effect as much. So that is one end of the coin. The other side of the coin is the new generation, the new markets, because while policymakers and the rest of the world, tobacco control stakeholders, are focusing on, oh, we've achieved this, we were able to bring it down, like you mentioned, it's not rising or falling. But there's a new target, there's a new generation they're targeting now. And most importantly, we are in the technology age where traditional marketing is no longer what it was before. You're able to reach more people with less, regulation. So from your experience in the research space, do you think policy, do you think the government, do you think this tobacco control stakeholders are ready to tackle this new generation and this new marketing ecosystem that the tobacco industry are already deploying in targeting the youth?
Yeah, so thank you so much. Let me say something first, that when you look historically, tobacco industry is one of the most powerful industry in terms of marketing. And let me give a little bit of history. What we call tobacco has been long used, or even cigarettes, in terms of just wrapping the shreds of tobacco. That was in 16th century. But what we really actually call cigarettes comes in around 18th century. And I think one of the story around it is, I think a man named James Barnard who actually was really doing this wrapping system and employing women to help in the wrapping. So at first they were using manual labor. Then I think it was Bonsack in the 1980s also that's really invented the first machine to really wrap.
Okay.
And in terms of really number of people smoking then, there was, in terms of cigarettes, people were using different other tobacco, for other things, but in terms of cigarettes, it's actually the lowest. So how did something that has the lowest get to the size becoming the biggest in terms of the different use of tobacco? I think it's a story of the ingenuity of marketing approaches of the tobacco industry from the beginning. In fact, when the machine was made, historically, we know that it's only about 50 cigarettes per population, I think, in the US. After a very few years, they are doing about 4,100 per population. Just see that increase. And it's due to marketing. So some of what we know in the as very like a gift card, baseball card, curated events. These are actually things that were really introduced by the tobacco industry.
Oh, so you mean that it wasn't like other brands? You mean it's tobacco industry?
Tobacco industry actually invented it, sort of. One of the guys that actually today we refer to as the father of public relation, Edward Bernard, is the nephew of Sigmund Freud, one of the famous psychologists. He actually applied Sigmund Freud theories to really tobacco marketing in the 1950s and 40s, and that led to really a movement whereby at that point in time, there's actually a very good evidence that tobacco is really wrong. So the tobacco industry actually brought him in to change the perception so that to really reduce the stigmatization, but also to change the picture such that you don't really need to see tobacco as whether it's impactful or its negative effect, but you see it as a kind of cultural thing. Speaking to libertarian kind of value system as a set of freedoms, and also in targeting new set of people like women, like youth, and all sort of. So I would say that whatever we're seeing there, it's actually what the industry is well famous for. If you can invent some of those marketing gimmicks, you brought in the father of public relation to really do a lot of things. So the industry has always been doing that. So it's not a very new thing. And it just speaks to the fact that if you are selling a product that has no benefit, what do you need to do? You need to sell brands, you need to sell other things, and the really industry is really focused on that, really just selling brands, selling, signaling, culture, things that are not really of any health benefit. Now, what we're seeing with the industry, two strategies. One, they really bring in consistently new products to really sidestep whether any policy government is making. So if government is really saying, no, cigarette is, we are really imposing ban on public advertisement. They do created events whereby and branded stuffs. They sponsor, for example, in Nigeria, they sponsor one of the best scholarships and quiz.
So that's corporate social responsibility.
Yeah, social corporate. Anyone want their children to be part of it. Well, in that event, you will see tobacco stuff display, and this is brought to you by tobacco. So people then to say, okay, they have some benefit to the to the population. So in every area you could look at it. So they have really perfected the art of really selling, selling nothing with just market gimmicks. And now what they are targeting is the youth, the rural area, and also women. And the idea is to really signal to them that this actually is a signal for empowerment. Also, to really sidestep whatever limitations the current policy environment imposed on them. So, for example, if we're talking about don't advertise, they move to social media as a marketing strategy. I mean, so all sorts of things, innovations. So it then becomes a kind of cat and mouse kind of game, whereby you're dealing with a very kind of a bad actor bent on not really playing the game or really always trying to be ahead in whatever regulation or regulatory approaches. So that's actually the big challenge that we have. And for practitioners, for researchers and advocates, the idea or the key thing is, one, to always understand the fact that let's stick to facts. Because one of the things is, fact is stubborn. And irrespective of whether you blend it with anything, you can't brand fake. You can't really rebrand facts. So if they are coming with marketing and what you are coming in is with fact, you will always win. So if we focus on facts, it will always help us. We can't actually be doing game for game. Marketing for marketing, but let's be playing marketing for fact. I think in the long run, we want it to be better in the short run, but fact will always win. So that's why research for advocate for government, we need to really talk about how do we really generate evidence that will bring facts to the table rather than opinion or passion, which they always bring to the table. The second aspect is, as public and researchers, when we have this fact, we need to then ask this question around how could we better ensure that we are not so far from their approach. Because when you even bring the fact to the table, they change the fact. So, for example, if you say, we are imposing ban on nicotine pouches, or they could actually really go in, creates other stuff that are not nicotine, but the chemical component actually works like nicotine. So they could actually do all sorts of things to really be ahead of regulation or policy. So we need to really anticipate those bases that they will always really come up with something to really dampen or weaken existing policy. But more importantly, we need to always anticipate what will be their next move. That's very difficult because they will move. They would also come with something that is innovative, radical, and really that enable or weakens the policy environment. So how do we always, first, the policy environment needs to be very dynamic. You can't say because you implement one law 5 years ago that you have solved the problem, because the industry within 1 year could do something that really just make all of those policies ineffective again. So you need something that is, you need to keep abreast of the situation. One new regulation, one new policy doing it. Then sometimes I think one of what has been well advocated is country needs to be really restrictive in their policy. They needs to be encompassing such that when we don't just regulate nicotine and things that actually have that same characteristics as nicotine. That will be more comprehensive, and so the industry will not say, okay, it's nicotine that government is saying, not this. So all of those things we need to be really keep abreast of what their action would be. So in a way, we need to really be working back and forth. They are not sleeping. We might also not sleep in order to make sure that we continue to get it right at the policy level, such that some of the gains we've made is not eroded, but also where we need to make more impact, we can actually achieve that. And I think that's the objective for public health researchers and also everyone.
And that's very interesting to know, especially this time where you mentioned facts for facts. So just before we round up, what do you think now that the industry too is also playing ahead of tobacco control? Tobacco control is pushing out facts. The industry is also pushing out facts as well. How can the public and also how can tobacco control stakeholders, will I say this year being countering, the tobacco industry, how can we counter their own facts? Because that is really what is happening now.
Okay, so I don't think there's multiple facts, even though we lived in what we called post-facts world. But there is also, there's only one thing on the table.
Truth, yeah.
Of course, it might have many sides to it, but it's only one fact. One set of body of knowledge that is clear. And I think that's the role of independent research and researchers. So, for example, CSEA is an independent think tank. Our research is not to say, oh, we're against tobacco industry, or we are for the advocate. All we say is, okay, let's see what the fact looks like. And so when we really go through the route of independent research, what you are likely going to come up with is things that really, so we don't say, okay, if you won't hear us say, no, there is no, when the industry said we have benefits, we said, okay, we acknowledge that there is actually, you're an economic entity, you pay taxes, you bring and say and mention investment. We look at that. So that's one part of the argument. But one thing that you must not do is to look at partial facts. And that's what the industry facts looks like. It's a partial kind of thing. When you say, oh, we invested $1 or $2 million into the economy. Oh, 500 people are working with us. We are paying tobacco farmers. Those are facts, but those are partial facts. Now, calculate all the economic benefit of all of this. Yes, give us the number. What does it amount to? Now, the other fact. Look at the economic costs of tobacco smoking on the Nigerian economy. Now, that's another fact. When you now bring together the two, you are looking at benefit cost analysis. If the costs on the economy and the benefit, your benefit is so small, your cost is so high, so the fact is that you are giving us net loss. The net benefit is negative. But whereas if we are looking at partial analysis, all we will just be hearing is, oh, investments, oh, jobs. But you will not be hearing, what are the economic costs on the public health? What about what government is really losing in subsidizing healthcare costs? And also challenges. For an economy that depends on a lot of out-of-pocket spending, what are those costs? So, and this actually should permit not just really basic economic, even in policy making. If you look at policy making, there will be some ministries, like let's say investment or trade, that would be core advocates for the tobacco industry. Yeah. Or maybe Ministry of Agriculture. They say, okay, farmers are planting tobacco plant. Then you look at Ministry of Health talking. So, but part of that, everybody will be saying, this is the fact, this is fact. But when you bring all the fact to one set of it, the question becomes, what are you bringing to them in terms of cost? What are you bringing in terms of benefit? By the time you add it up, that's actually what becomes the actual fact. And so the two things is, we need the role of independent research, because you can actually take the industry word for it. Like you mentioned, it's an industry that doesn't want to lose out. So, and the idea is, okay, you said, and we now accepted that this is bad. We've created another one. You should be using it. To what extent have we used that for us to know how bad it is, right? So, for example, we know from cigarettes that it takes, some number of years for us to really start seeing the effect on lung cancer. This one now, have we have enough time to really test or make that conclusion? So those are kind of things. So you can't really take industry facts at the face value and accept it. So, but what we are saying is, if we have independent opinion, but more importantly, if we bring in every point of view, the fact is still clear that it's actually more of a cost in terms of on the economy, and there is only marginal benefits.
Thank you very much. It was great having you here. And thank you for joining us on this episode of Tobacco Control Conversations. You can learn more about our work in tobacco control by visiting our website at www.tobaccocontroldata.org. Also, if you can follow us on social media at CSEA Africa.